My name is Gayle Harris, Durham County Public Health Director. This spring, cases of novel H1N1, often referred to as swine flu, began to pop up around the United States. The first case to surface in Durham County was confirmed in late May. This new influenza, never circulated among humans before this time, has brought major concerns to the healthcare world and to those most susceptible to the condition. These populations include the young, the old, and those already challenged with respiratory issues. According to a recent federal study, pregnant women are increasingly likely to be infected with the virus. Information important to the understanding of the evolving virus continues to be gathered by researchers and doctors across the country. What we do know is that novel H1N1 is considered a pandemic and that it is vitally important that you learn how people become infected with the virus, signs and symptoms of the infection, and that novel H1N1 is different from other seasonal flus and epidemics. In response to the growing concern regarding novel H1N1, Dr. Jeffrey Engel, North Carolina State Health Director, made the following prevention message. Please listen closely to Dr. Engel's message that details the simple steps you should take to protect yourself from H1N1. Symptoms of the condition, and when you should see your doctor.
Hello, I'm Dr. Jeff Engel, the North Carolina State Health Director, and I'm here to talk to you today about H1N1 influenza or flu, the novel influenza virus that is responsible for the current pandemic. In the early summer, the WHO, the World Health Organization, declared a pandemic caused by this new strain of type A influenza virus that we call H1N1. Already by mid-June, North Carolina State had reported over 100 cases, but this likely represents only the tip of the iceberg, and it is likely that thousands have been infected. Fortunately, the disease is mild, and most people do not see the doctor. Therefore, these are the cases that we do not know about and cannot count. But those that have been tested, we have over 100 cases in North Carolina so far. It looks like this virus is going to be with us through the summertime and into the next flu season. And I'd like to use this opportunity to tell you again and remind you that during the summertime, when we don't usually expect it, flu will be here with us in North Carolina. We know that the H1N1 flu virus is very easily spread from person to person, and we know how it is spread. It is spread by the cough or sneeze that comes out of our nose and mouths and on our hands. This is known as the droplet transmission or direct contact transmission through our hands. So the way to prevent spread is really easy when you think about that. So if you have the sickness of flu, you want to cover your mouth and nose when you're coughing or sneezing into a tissue. You want to throw that tissue away promptly and wash your hands as soon as possible after that. You also want to just, in general, wash your hands frequently during the daytime, whether or not you're sick, which is always a good health practice. Remember that the symptoms of flu are cough, sneeze, sore throat, and usually a fever greater than 100 degrees with headache, muscle aches, and sometimes stomach ache and diarrhea. You should see your doctor if these symptoms become severe. Things such as a severe headache, chest pain, shortness of breath, a cough that won't go away. These are worrisome symptoms that means that you should see your doctor. Young children can become dehydrated easily with nausea and vomiting and diarrhea from stomach aches. And if that happens and they can't keep fluid down, that would be another reason to see your doctor. Doctors have medications that they can prescribe for this flu, which is the good news. And we hope to have a vaccine available in the coming months, hopefully as early as October or November. So stay tuned for that as well. So again, a reminder that H1N1 influenza is here. It's going to be here during the summer. And there are some simple things that you can do to protect yourself. Wash your hands frequently, cover your cough and sneeze with tissue, and when you're sick, stay home from work or school. Thank you very much and have a very safe summer.
As you can see, novel H1N1 is a serious condition. To curb the number of human cases of pandemic H1N1, You must take the necessary steps to protect yourself. Also, know what resources are available to you. For more information regarding the virus or influenza-like illness, visit the Durham County Health Department's webpage at www.durhamcountync.gov. There you will find links to local and national resources and a wealth of educational materials. You may also call 919-560-7882 or email your questions to health@durhamcountync.gov. Again, a reminder, H1N1 will be with us throughout the coming months, and there are simple steps that you can take to protect you and your family. Thank you.